Hello, everyone. I'm Catherine Mortensen from ALEC Public Affairs, and we're coming to you from the States and Nation Policy Summit in Washington, D.C. today. And I'm so thrilled to be joined by two very special guests, Cynthia Fisher, who is with Patient Rights Advocate, and Representative Patrick Neville of Colorado. And what we want to talk to them about today is healthcare transparency, billing. Tell us exactly what this issue is and why it is a problem for so many Americans.
Healthcare price transparency
Thank you.
is hugely transformative. And the Trump and Vice President Pence administration delivered free market principles to all of us by making it that every hospital and every insurance company has to show all of the prices in healthcare as of January 21st, 2021 for hospitals and July of this year for insurance companies. That's huge. Why? Because it shifts the power to the consumer, to patients, to be able to know prices in advance of care and usher in quality discovery as well. So we're going to see comparative prices, just like shopping for airlines or anything else we have online, to be able to know where to get a $300 MRI versus paying $3,000 and being able to save their own money. So this is a huge win for the American consumers, because not only does price transparency give us the right to shop in healthcare, but it allows for unleashing competition, better quality, lower costs, and moreover, avoiding being overcharged, because when we have prices, we have accountability to make sure the bills match those very prices. So we're assured and have financial certainty of saving our own money.
And Representative Neville, what is the role that states play in this? If it sounds like this was done through some sort of executive action, why are states needing to get involved?
Yeah, so it's done through executive action, but we can leverage those rules through a different enforcement mechanism. So I wanted to do something in Colorado about this, and I was so excited because for 8 years that I was in the legislature, it seemed like we wanted to wait on the federal government to do something. This is something states can do now. So what we did is we actually gave the consumers the ability to be the enforcement mechanism within the Colorado bill. So the consumers themselves, on the date of their service, the hospital is not compliant with the pricing transparency rules, then we deny the hospitals two critical infrastructures to the state-sanctioned collection agencies and the state court system. So if they're not compliant and the hospital tries to send them to collections or sue them, the hospital can sue for the whole amount of their bill back plus attorney fees. So instead of just government bureaucrats being the ones who can enforce it, the consumers themselves can enforce it. And this is something that every state could do. And Texas also codified in their state statute the federal rules, which I would encourage them to do. So ALEC model legislation takes the two best pieces of the Texas version and the Colorado version and puts them together.
I love that. And you just spoke to our ALEC members here at our lunch. Cynthia, you shared a couple examples of people that you have known and worked with who have run into this nightmare of these non-transparent medical billing practices. Tell us one or two of these stories, just so people get a sense of what the problem is.
Yes. In Virginia, a woman by the name of Wanda Brooks was taken to court for overcharges in her medical bill from an emergency room visit. Just to treat her for dehydration, she ended up with over $8,000 in charges, and the hospital garnished her wages, half of her wages. As a single mother with two daughters at home, half of her wages were lost to the hospital overcharges. We helped her with a lawyer and found that those charges were not reflective of her actual care, and were able to get the billings totally wiped off her record and free her of that garnishment and put the money back in her pocket. But also, everyone has a story. All of us know either from firsthand experience ourselves or a family member who has been overcharged by the medical system. And the only way we can prevent being overcharged from errors, fraud, and high bills that don't match our medical experience is to see prices up front, have accountability with those prices, and be able to fight with remedy and recourse when we have been overcharged. So it allows us to shop much like we would if we were shopping for airlines or think of even the future with all of this data now, our right to be in our hands. However, sadly, Catherine, unfortunately, the hospitals are not complying with the law.
So that's why the states need to come in to enforce it. Is that my understanding that right?
Yes, and we do a semi-annual report. Our last report showed only 16% of the country's hospitals are fully complying with this law. And they're preventing the tech world and all of us as consumers from actually knowing prices before we go. So the states have stepped up to enforce the law because this current administration is not enforcing by issuing the civil monetary fines of $2 million per hospital. So the states are saying we can get it done. And so ALEC has drafted legislation that's modeled off of what Patrick did in Colorado and Governor Youngkin delivered in Virginia, and now Texas is coming on board. So ALEC's legislation in this next session can essentially enable a free market in healthcare and allow functional, competitive market where the consumers, as consumers and employers and workers and all of us, will be able to benefit from competition and our own personal choice. Otherwise, if we do not get this done in the states, there's a high risk that bigger and bigger government will instead work with the healthcare industrial complex to deliver socialized medicine. Because what this ALEC legislation does is it codifies what President Trump and Vice President Pence got done.
Right.
And it puts the data in our hands and empowers patients to be able to lower their cost and have financial certainty and better quality of care.
Thank you so much. And before we close, Patrick, I want to ask you one last question. But I want to get the name of Cynthia's organization, the website up, patientrightsadvocate.org. And we'll take a look at that right now. Let me get that screen up. You can see their mission statement there. Our mission, just like Cynthia said, is ushering in system-wide healthcare price transparency. I imagine this is a fabulous resource for state lawmakers who want to get data on what's going on. Who else might benefit from this website?
Absolutely. The state lawmakers actually can go to our website. We do a semi-annual report, and in it, we break it down by states to let you know each of the hospitals we've evaluated in each of your states so that you can see who's compliant and who's not. But moreover, we will be doing our next report. It'll come out this coming January. And we are also there to support the ALEC members that are going to lead the charge to deliver free market competition and choice to the American people. It will restore the American dream because, look, many small businesses and even state budgets are being harmed by the runaway cost of healthcare. And the first foundation to be able to get a free market is you have to know prices.
Right.
Because none of us would pay more than 10 times than another for a gallon of milk in the grocery store. We would never buy a sweater without knowing what it costs or go out to dinner or get a hotel room. And yet every day in healthcare, we sign away a blank check and we're blindsided by outrageous medical bills. So we need these prices to be the first foundation to create free market. And now is the moment of time because we have the right by law codified into states. We can drive down the cost because states can make everyone in healthcare accountable for system-wide free market competition and choice.
Thank you so much. And Representative Neville, what advice do you have for lawmakers in other states on how to get this through and get it to their governor's desk and signed?
So this bill in Colorado was extremely bipartisan. I actually sponsored it with a representative I'd served with for 8 years. And we hadn't agreed on a single piece of legislation prior to that. And so her name was Representative Nesgar. It became known as the Nesgar bill after the chair of the committee made a mistake and said, Representative Nesgar, present your bill. So I'm like a Rand Paul type. She's like a Bernie Sanders type, but we actually agreed on this bill. Got it done in Colorado 99-1. So the biggest advice I can just tell them is just go do it. Get in touch with patientrightsadvocate.com and .org. And they'll be a great resource for you. Cynthia showed up in my committee. That's the first time I ever met her. She's been wonderful ever since then. And so just go out there and do it. We're going to help you do it. And this is 1/5 of the American economy that we can inject market forces into that we haven't had since I've been alive at 39. They've never been in the healthcare market. So you can do some great things for your state if you get this bill done.
I think another thing, Catherine, to mention is Montana got a hold of this pricing data from claims, and Marilyn Bartlett was able to save the state in 2 years $121 million for their 30,000 employees, increase wages, and give them premium holidays with that savings, but more, put money back into the state coffers with all of those savings. And this is huge because think about what this means for the American dream. Every employer getting access to these data can be able to steer their employee plans to getting the best care at the lowest possible prices and basically put it back into wages and put it back into corporate earnings. And it's a great win for the American people. The Republican administration delivered the rights, and now it's up to the state legislators. And I think everyone can get it done in this next session to make a big, big difference for the American economy in the leadership of the ALEC members.
Go to patientrightsadvocate.org. It's right there on the screen if you want to learn more and get involved in bringing down the price of healthcare and helping your constituents if you're a lawmaker. Thank you all for watching, and we'll see you next time on another ALEC TV broadcast.